Sometimes it feels like doctors just know things, like they have this extra sense.
Right. It's fascinating.
And today we're looking into something exactly like that. How these, seemingly small personal hygiene habits in older adults can actually be huge red flags.
Flags for serious health issues that doctors pick up on, sometimes immediately.
Exactly. It just shows how our daily routines, the little things, are so tied into our overall health.
Yeah, what looks like just a minor slip can actually be a pretty significant signal.
So today we're doing a deep dive into 7 common personal hygiene mistakes older folks might make, and importantly, what those mistakes tell doctors straight away. This isn't just about, keeping neat and tidy. It's really about understanding how these habits can give early clues to bigger health problems down the line.
And the goal is really to help you, the listener, understand these connections.
Right. So you can spot potential issues, maybe adjust some daily habits, and ultimately help maintain better health, confidence, and importantly, dignity as we age.
We'll cover quite a range from mouth care all the way down to your feet.
And honestly, some of these links are genuinely surprising. It makes you think, doesn't it?
It really does. You start wondering how closely you're actually paying attention to these, little things in your own life.
Yeah.
Or maybe for your parents or relatives.
Yeah, it's so easy to just write things off as, they're just getting older.
But often there's more going on beneath the surface.
Okay, so let's kick things off. Mistake number 1, neglecting oral care.
Seems basic, right? Brush your teeth.
It does seem basic, but the mouth, it really is a major gateway to the rest of your body. And with age, sometimes our natural defenses there, they can weaken a bit.
Making bacteria more of a threat.
Exactly. Even small imbalances can become a bigger deal for overall health.
And doctors notice the signs, like a toothbrush that's clearly seen better days. All frayed bristles.
Right. You wonder how much cleaning that's actually doing, or brushing maybe just once a day or not at all sometimes, and skipping flossing altogether.
Little things maybe, but they add up. They really do. Look, there's solid research. Harvard Medical School, for instance, linking bacteria from inflamed gums, gingivitis, or periodontitis to a higher risk of atherosclerosis.
That's the hardening of the arteries.
That's the one. And also heart attacks, strokes, and even worsening memory loss in older adults.
Wow.
Think of your gums like a barrier. If that barrier is breached, bacteria can get into the bloodstream and travel.
That's a really powerful image. And I read that patients over 65 with severe gum inflammation were 3 times more likely to have cardiovascular disease.
That's right, 3 times. It's a significant link.
So, okay, what can people do? What are the practical steps here?
Well, the good news is it's pretty straightforward stuff. First, replace that toothbrush every 3 months or sooner if it looks worn out.
Makes sense.
And maybe think about an electric toothbrush. There's a study, University of Pennsylvania, I think, showing they can remove up to 62% more plaque than manual ones.
That's a huge difference.
It is. And the key is brushing long enough, 2 full minutes, twice a day. Setting a timer actually helps a lot of people.
Good tip.
And floss every night. You got to get that stuff out from between the teeth where the brush can't reach.
Okay.
And finally, don't skip those dental checkups. Every 6 months is ideal for catching things early.
Simple habits, but sounds like they have a massive payoff for health. Okay, let's move to mistake number 2, infrequent bathing and not taking proper care of the skin.
Yeah, there's sometimes this idea, especially maybe in colder weather, that older adults don't need to bathe as often. Maybe just once a week.
That's not quite right.
Well, it's interesting. Skin does get drier with age, that's true. But bathing less often can actually hide important signs of health problems.
It's like what kind of signs?
Your skin reflects your internal health, right? So things like liver or kidney problems or even diabetes can show up as changes in skin color, maybe persistent itching or dark patches appearing.
I didn't realize the skin was such a telltale.
Well, yeah. Mayo Clinic research suggests that something like 40% of chronic skin conditions in older adults might actually be the first sign of one of these underlying medical issues.
So skipping baths could mean missing those signs.
Exactly. It delays detection.
Okay, so what's a good, healthy routine then?
Generally, aiming for a bath or shower at least 3 times a week is a good baseline. And it's not just about getting clean.
It's a chance to look things over.
Precisely. A chance for a quick skin check. When you do bathe, use a mild soap. Fragrance-free is best, so you don't strip away those natural oils that are already decreasing.
And moisturizing is key, I guess.
Absolutely critical. Apply a good moisturizing cream. Look for things like ceramides or glycerin while the skin is still a little damp. That really helps lock the moisture in.
Okay.
There's a finding in the Dermatology Clinic's journal back in 2020 that said regular bathing plus moisturizing actually doubles the chances of spotting skin issues or related health problems early.
Doubles. That's significant. What about water temperature?
Good question. Lukewarm is best, sort of 37 to 40 Celsius. Hot water feels good, maybe, but it really dries out and irritates older skin.
So lukewarm stimulates circulation a bit without stripping the oils.
You got it. And yeah, use that time in the bath or shower to just scan your body, any new moles, weird rashes, sores that aren't healing. Keep an eye out.
Good practical stuff. All right, mistake number 3, neglecting nail care. This feels like another one that's easy to overlook.
It really is. But our nails, they can tell a surprising story about our overall health. And often, changes happen so gradually that the person doesn't think much of it.
The doctors notice. What are they looking for?
They might see nails getting thicker or changing color, maybe yellowing or browning, or even just how they're being trimmed if it's done improperly.
And these aren't just cosmetic issues.
Not at all. These changes can be linked to things like anemia, thyroid problems, or even diabetes, which can impact circulation right down to the fingertips and toes, affecting nail growth.
Wow, I wouldn't naturally connect my thyroid to my fingernails.
Most people don't. And on top of that, nails that are thick and discolored are also more prone to fungal infections.
Ugh.
Yeah, leading to itching, swelling, sometimes even deeper infections if they're ignored. The American Academy of Dermatology estimates over half of people over 60 have some kind of nail issue.
Over half.
And get this, for up to 30% of them, those nail changes are actually the first clue that they have some other systemic disease.
That is really striking. So proper nail care, what does that involve?
It's about technique and just being consistent. Trim nails straight across, maybe just slightly rounded at the corners. This helps prevent ingrown nails, which can be a real pain, literally.
Especially for older adults, yeah.
Yeah, keep the nails and the skin around them clean and, importantly, dry. Dampness encourages bacteria and yeast.
Shoes and socks matter too, I bet.
Big time. Wear shoes that breathe and change your socks daily. Natural fibers like cotton or wool or those antimicrobial ones are good for absorbing sweat.
And when should someone actually worry and see a doctor about their nails?
If you see cracks, broken skin near the nail, or any dark spots or reddish patches under the nail, don't wait. Get it checked by a dermatologist or a podiatrist. Delaying can lead to bigger problems.
Okay.
Oh, and diet helps too. Making sure you get enough biotin, zinc, omega-3s. Those nutrients support nail strength.
All really valuable. Okay, now for number 4, which can be a really difficult topic for people. Improper incontinence management. The research here really highlighted some serious potential consequences.
Yes, this is a big one. And what really stands out is the embarrassment factor. It's understandable, people feel private about it, and they often try to manage urinary incontinence on their own without talking to a doctor or using the right products.
So they might use, what, makeshift things?
Yeah, exactly, like maybe regular sanitary pads or tissues, things like that.
And what's the problem with that approach? I mean, beyond just maybe not working perfectly.
Well, if you think about it, those products aren't designed for urine. Urine often comes out faster, and it's different chemically. So makeshifts don't absorb it well, leaving the skin wet for longer periods.
Which leads to skin problems.
Big time. Increased risk of skin breaking down, infections, painful irritation, even pressure ulcers if someone is less mobile.
That sounds awful.
They can be. And Johns Hopkins Medicine reported that over half of older adults deal with some incontinence. When it's not managed well, it doesn't just affect the skin. It can increase the risk of falls because people rush to the bathroom.
Hadn't thought of that link.
And it can even delay finding out about underlying issues like problems with the bladder or, in men, the prostate, sometimes even cancer.
Okay, that is a stark warning. So what is the right way to manage it?
First step, and maybe the hardest, is talking to a doctor. It's crucial because incontinence isn't just something you have to live with. Often, it's treatable.
That's really important to hear.
Absolutely. And then use the right tools. Products made specifically for incontinence absorbent underwear, adult diapers, medical pads. They're designed to pull moisture away quickly and keep skin drier. That dramatically cuts the risk of skin issues. And hygiene is still key. Clean the skin right away after any wetness. Use a pH-balanced cleanser, not harsh soap, and dry thoroughly.
Right.
This helps prevent bacteria and lets you see if the skin looks okay.
Right.
And just to really hammer this home, incontinence is not a normal, inevitable part of aging. A study, I think Journal of Urology 2020, found over 60% of cases can be significantly improved with things like pelvic floor exercises, Kegels, lifestyle tweaks, if caught early.
That's incredibly empowering.
Okay.
Okay, moving on to mistake number 5, improper ear hygiene. We all clean our ears, or think we do, but are we doing it wrong?
Well, what's really common is this belief that you need to get deep inside the ear canal to clean it well. And the tool most people reach for.
Cotton swabs, Q-tips.
Exactly, the go-to. But they're actually a major problem.
How so?
If you look at the official guidance, say from the American Academy of Otolaryngology, they point to cotton swabs as a primary cause for about 40% of eardrum perforations.
Wow, 40%.
Yeah. And they're also a frequent cause of infections in the ear canal. See, instead of pulling wax out, you usually just push it deeper in, creating a blockage.
Like impacting it.
Right. And you can easily scratch the very delicate skin inside the canal. That little scratch is an open door for bacteria, leading to inflammation, itching, pain, even hearing loss.
Ouch. Okay, so how should we be cleaning our ears?
The main thing is focus on the outer ear only. Use a soft, warm washcloth, maybe some sterile gauze.
Yeah.
Gently wipe the outside parts. Don't stick anything solid deep into the canal. No swabs, no hairpins, nothing.
So the ear canal kind of cleans itself?
Largely, yes. The skin inside migrates outwards, carrying wax and debris with it.
Yeah.
If you do get wax buildup, some people are prone to it, you can use specific ear drops.
Like what?
Ones containing glycerin or maybe a 3% hydrogen peroxide solution. They soften the wax over a few days, letting it drain out on its own, or making it easy to just wipe away from the outer opening, maybe after a shower.
And if you have ear pain or discharge?
Don't mess around. See a doctor immediately. Pain, discharge, sudden hearing loss. These could be infections, or rarely something more serious like a tumor. It's important to get it checked.
Right.
There was a Johns Hopkins study in 2021 showing over 30% of older folks hospitalized for ear problems had conditions worsened by, well, trying to fix it themselves improperly.
A good reason to seek professional help. You mentioned omega-3s for nails earlier. Any link to ears?
Some research suggests omega-3s might help by improving blood flow to the ears and potentially reducing inflammation. Worth looking into, maybe.
Interesting. Okay, let's tackle mistake number 6. Poor foot care. Our poor feet, they carry us everywhere, but often get ignored until they scream at us.
They really do. And what's crucial here is that our feet can actually give us really early warnings about several health conditions, but the tendency is just a quick wash, maybe not drying properly between the toes.
Or just thinking, oh, my skin's dry and cracked, that's just age. Or my feet feel a bit numb sometimes, must be getting old.
Exactly those kinds of dismissals. But neglecting foot care can be incredibly risky, especially for certain groups.
Like people with diabetes.
Especially them. Consider this. A 2018 study, Journal of the American Podiatric Medical Association, stated over 85% of amputations in diabetics are preventable with proper foot care.
85% preventable. That's staggering.
It really is. So, dry, cracked skin isn't just unsightly. It's an open door for bacteria and fungi. That can lead to cellulitis, a serious skin infection, or even deeper infections.
And the numbness.
Numbness or tingling can signal peripheral neuropathy. That's nerve damage, often linked to diabetes, but also poor circulation. Diabetes Care Journal in 2019 said up to half of type 2 diabetics have some neuropathy.
And that leads to...
It means you might not feel a small cut or a blister or pressure from a shoe. That injury can then get worse, develop into an ulcer, and in severe cases lead to tissue death, necrosis, and potentially amputation.
Okay, this is clearly critical. What does proper foot care look like day to day?
It needs to be a routine. Wash feet daily. Use warm water, not hot, and gentle soap. Make sure you clean carefully between every toe.
And drying is super important.
Absolutely critical. Dry them completely, paying extra attention to drying between the toes. That's prime real estate for fungus.
Then moisturize.
Yes, apply a good moisturizer, maybe one with urea or lanolin, to the tops and heels. But avoid putting lotion between the toes. You want that area dry.
Okay.
And inspect your feet every single day. Use a mirror if you need to see the bottoms. Look for cuts, red spots, blisters, swelling, any changes at all. This is non-negotiable if you have diabetes.
What about socks and shoes?
Choose socks made of natural fibers or moisture-wicking materials. Avoid tight ones that constrict circulation. Shoes should be roomy, well-cushioned with non-slip soles. Good footwear prevents injury and supports circulation.
Makes sense. Any exercises?
Simple things help. Wiggling your toes, making circles with your ankles, doing that daily stimulates blood flow. And again, diet plays a role. Omega-3s, vitamin D supports skin and nail health on your feet too.
Really comprehensive advice. Okay, finally, mistake number 7. This one's subtle overlook of hygiene changes that might actually be side effects of medications.
Yes, this is a connection that isn't always obvious, but sometimes a noticeable shift in someone's hygiene, maybe how often they bathe, their body odor, skin condition, can be an early sign that a medication isn't agreeing with them, or even that it's affecting their liver or kidneys.
Especially with new medications.
Particularly when starting a new drug, yeah. A 2020 study from the American Geriatric Society found that almost 40% of adverse drug reactions in older adults actually show up first through these kinds of external hygiene symptoms.
Wow. Like what specifically?
Well, take dry mouth, for example. Super common side effect of many drugs, anticholinergics, diuretics are big culprits. Harvard noted this back in 2019.
And dry mouth isn't just uncomfortable.
No. Less saliva changes the pH in your mouth, lets bacteria thrive, increasing the risk for tooth decay, gum problems, even sore throats.
Okay.
Unusual sweating, maybe excessive sweating, or a change in body odor. That can sometimes be a sign the body's working overtime to detoxify something, possibly indicating stress on the liver or kidneys.
Really?
Yeah, the Journal of Geriatric Pharmacology mentioned this in 2018, finding body odor changes in a fair number of patients, starting things like statins or blood pressure meds.
And skin changes?
Abnormal skin discoloration is another big one. Yellowing, which could be jaundice indicating liver issues, or unusual darkening redness that could be an allergic reaction. The American Liver Foundation highlights these signs.
This is a really important link for people to be aware of, especially if they're on multiple medications.
Definitely.
So what's the takeaway? If someone notices these kinds of changes after starting a new med, what should they do?
First step, keep track. Note down the new medication, the dose, and exactly what changes you're seeing. Dry mouth, more sweating, skin turning yellow, whatever it is.
And tell the doctor right away.
Absolutely. Inform your doctor immediately. And critically, never just stop taking a prescribed medication on your own. Talk to the doctor first.
Good point. Anything else they can do?
Staying well hydrated, drinking enough water, if the doctor says it's okay, helps the body flush things out and can ease dry mouth a bit.
Oh, okay.
For dry mouth relief, maybe sugar-free gum or special mouth sprays can help stimulate saliva, and a good moisturizer for any drug-related skin dryness. But again, run these by your doctor first.
This has been incredibly insightful. Just to quickly recap the 7 mistakes we covered: neglecting oral care,
Infrequent bathing and poor skin care,
overlooking nail health,
improper management of incontinence,
using cotton swabs or improper ear hygiene,
poor foot care, especially with diabetes.
and finally, not connecting hygiene changes to potential medication side effects.
That's the list. And addressing these, well, seemingly small things can make a huge difference in protecting health, maintaining that sense of confidence and independence, and preserving dignity as we get older.
It really drives home how much these everyday habits matter. So maybe here's a thought to leave you with. Just take a moment, reflect on your own hygiene routine, or perhaps the routine of an older person you care about.
Yeah.
Are any of these 7 mistakes possibly happening? Maybe just a small tweak, a slight adjustment could unlock some significant long-term health benefits. It's definitely worth thinking about and maybe even bringing up at your next doctor's visit.